And all of our guests are in the studio with us this morning. Let me start with you, Dr. Besser. The latest figures we have now, I think 800 cases worldwide, 473 in Mexico, 19 countries now, 20 deaths, but 19 of those in Mexico. Where do we stand in all of this?
Well, what we're reporting in the United States, 160 cases, 21 states. It's a rapidly evolving situation, and it's still one that is cloaked in uncertainty. But each day, we're getting more information. We're getting more information about what's going on in Mexico, and we're getting more information around what's going on in this country. And we're starting to see encouraging signs.
Why do you expect more deaths in this country?
You know, it's important to put in perspective influenza. Each year during seasonal flu, we see 36,000 deaths in this country, 200,000 hospitalizations. With a new strain of flu, a strain of flu that people don't have immunity to, you would expect that there are going to be hospitalizations, and unfortunately, there will be more deaths.
Secretary Sebelius, will we be ready when flu season comes? Because we're 5 or 6 months away from that now. Will this be under control, as it were, by then?
Well, while we don't know exactly what this virus is going to do, and as Dr. Besser just said, the early news seems to be cautiously optimistic about where we are right now, we certainly can't get complacent. We need to get prepared. So we are aggressively focused on not only trying to make sure that the spread of this is as contained as possible, limiting the contact of sick people with one another, but also to ramp up vaccine productions. We are underway producing seasonal flu vaccine. We know we're going to need it. We're accelerating that production, and that the manufacturers have been great partners in doing just that. We are testing the virus strain for H1N1 virus so that we're ready to go into production later in a month or two, when we make sure that we have the right dosage and the right test. So we'll be ready for both, and I think that's very important.
You obviously can't have a vaccine yet because we didn't know about this, but will we have it, say, by the time flu season hits?
The goal is fall target, and you're absolutely right. You can't develop a vaccine for a viral strain you've never seen before. So they've identified a virus strain. They're testing it and growing it right now. They'll test it and make sure we have the right dosage. The FDA, the Center for Disease Control, and the National Institutes of Health are working as collaborative partners. That was one of the first things the president did, is bring together the key health agencies to say we need to get out ahead of this, and that's going very well. And we're working with the laboratory partners, the manufacturers, to make sure that the production line is cleared and ready.
Basic question, so many people have asked, why didn't you close the borders, Secretary Napolitano?
Well, because we've relied on science and epidemiology, and the epidemiologists say, the scientists say, it would have done no good at all and come at enormous cost. And so we focused our efforts on things that would do some good. Educating Americans about what they can do, you know, covering your mouth when you cough, not going to school or sending your child to school if they're sick. Those sorts of things. And then working with the private sector, other government agencies, whatever, saying, look at your own planning, look what you need to be prepared for in case this really does cause widespread absenteeism.
Has there been overreaction? A lot of schools have closed, a lot of kids are being kept at home.
No, I don't think you can say there's been overreaction. You have to get ahead of flu, and I think local decision makers were having to make hard choices based on an evolving scientific profile. I think Dr. Besser can address this, but
I think, Secretary, you're right.
Gets transmitted very, very quickly, particularly among school-age children. So they had to make their best estimates about what to do given the situation they had, and then we rely on the science to help clarify the situation as we work through the cycle.
Yeah, with a new infectious agent, a new emerging infection, you may only get one shot at trying to limit the impact on health. And so you come at this very aggressively. And then as you learn more, you're able to tailor your response, back off on those things that are no longer needed. And as we gain more information, I fully expect we're going to be able to tailor that further.
I keep hearing that there's some guidance being prepared by the federal government on what people in offices should do, but the guidance is not ready yet.
You know,
What does that mean?
we've put out more than 24 guidances on various aspects of managing patients who have flu, protection for health workers, protection for individuals who are involved in customs and border issues. Lots of different guidances. The main guidance for people who are in offices is if you're sick, do not go to work where you're going to share that infection with other people. Stay home until you're better. Same thing that you would do with your children, you need to do for yourself.
Secretary Sebelius, I keep wanting to call you Governor Sebelius because I've done that for so long. Were we ready for this? You've been on the job now 3 days. You just got confirmed. Was the government ready for this?
You know, I think what's impressive is that certainly planning for a pandemic incident started a number of years ago, and that has been very, very helpful. States have plans, businesses were asked to develop plans. In fact, the first time I met Dr. Besser, I was co-hosting with our border state of Missouri a pandemic exercise, a meta leadership exercise, and Dr. Besser came to lead it 2 years ago. We had 1,000 people from the public and private sector together. So resources have been drilled down to states. All of that from the prior administration, I think, is helpful. President Obama was determined to take aggressive action and let the science be the guide. So he has assembled an intergovernmental team working across agencies of government and working very closely with the international community to make sure that the World Health Organization is well coordinated with our efforts. So I think this has been a very aggressive and a very appropriate approach to a brand new viral strain that no one had seen before. I mean, what we want to do is make sure we're taking prudent steps to keep America safe.
Let me ask you, and maybe the others can join in, but is there a danger that this may mutate into something more serious than what we're seeing now?
Well, again, Dr. Besser will add to this, but yes, the danger is that when it could come back in the fall, it could come back in a more virulent form. And so all of the work we're doing now not only was designed to get ahead of this outbreak of the flu, but there's a lot of planning that individuals and families and businesses and government is going to have to do over the course of the summer as we prepare for the next flu season.
Is this going to be a worldwide pandemic?
Oh, I think already it is. And I think it's important to be clear about what pandemic means. When the World Health Organization goes from 3 to 4, 4 to 5, and so forth, that doesn't associate with the severity of the disease. What it means is how widespread it is. So when you talk about level 6, which they very well could go to this week, all that means is it's widespread throughout the world.
It would be widespread, but and I wasn't quite sure I understood your first answer, Doctor. Should we expect more deaths? Will that be inevitable in this country as we find out more about this?
I think that we will, given that there are people who have underlying medical conditions who are frail to begin with. Influenza is a serious virus, but the good news is when we look at this virus right now, we're not seeing some of the things in the virus that have been associated in the past with more severe flu. That's encouraging, but it doesn't mean we're out of the woods yet.
Any final message for the American people?
Well, I think as the Secretary and Doctor have already said, I mean, what we want people to do is take some steps. Wash your hands frequently. Cough into your sleeve, not into your hands. And certainly if you're sick, stay home. If your children are sick, keep them home. That's a step we can take to contain the spread of this disease. We know it spreads from person to person pretty rapidly. And go to the CDC website. Every day at 11, it's updated with cases and information and guidance. We're trying to drive people to the science. And as Dr. Besser said, it's changing every day, and we're trying to stay ahead of this.
All right. Well, thank you all so much for coming by. We appreciate it.